Most unusual eating patterns or difficulties with eating are not eating disorders, but sometimes if the pattern is in a particular way or becomes particularly difficult, it can become known as an eating disorder. Two of the most common eating disorders in children and adolescents are anorexia nervosa, sometimes just called anorexia, and bulimia nervosa, mostly just called bulimia. Anorexia is characterised by an intense fear of gaining weight, and your child will likely be very underweight through not consuming enough calories. On the other hand, bulimia is characterised by consuming large amounts of calories in a binge, but then they will compensate for that by vomiting or by over-exercising. Some of the common signs you might notice in your child are severe weight loss. You might notice that they are often tired or fatigued, or they're often very cold. You might notice that they are leaving the table after dinner and you have suspicions that they might be being sick. But it's important to remember that there are many different types of eating disorders, so the specific signs that you notice might differ depending on what's going on for your child. There are some red flags that you should be aware of as a parent. That means you should seek more urgent help from a professional. These will include things such as thoughts about suicide or self-harm, or if they're withdrawing completely into their bedroom, if they've had rapid weight loss, or if you notice that they're purging regularly. You may have concerns that they've got low body temperature or their heart rate is going a bit slower. You'll need to seek urgent support if they're refusing to eat anything, even small amounts. You should try and get an emergency appointment with your GP or call 111. In a real emergency, if you're concerned about the safety of your child or the safety of somebody else, you should dial 999 or go to your nearest emergency department where they'll have mental health professionals on hand to help you. Our first tip is to refocus the conversation away from food and weight. We know with eating difficulties, food and weight can become the centre of a lot of the conversations because that is what's causing a lot of the stress. But as parents, you should try and focus the conversation on the underlying feelings that your child might be going through. A lot of the focus is on food and weight, but it's important to remember that that is just a symptom of the underlying distress that your child will be feeling. Our second tip is to learn ways to tackle meal times. Naturally, meal times can be a big source of distress and conflict when dealing with eating disorders. One thing you can do is to plan the meals in advance, avoiding last-minute changes, and being resolute that once that has been agreed that the meal is eaten. Eating together as a family might help with that as well. It is important to try and keep the emotional temperature down during meal times, trying to keep things light-hearted. If this is difficult and if conversation is becoming particularly around food again, you might put the TV on or the radio just to try and keep distracted and away from just talking about the food. Our third tip is to practice relaxation and distraction. If your child becomes stressed during meal times, there are some things they can do to calm their body and their mind. They could step outside for a breath of fresh air. They could try splashing some cold water on their face, or they could get an ice block and rub it on their face. They could also practice some calm breathing techniques. This might help your child manage their anxious feelings and can bring the emotional temperature of the mealtime down as well. As a parent, you could encourage them to take part in activities and hobbies or social events that don't have anything to do with food. Helping your child to focus on activities outside of food and eating helps put their life back into perspective and show them that there is more to life other than food and weight. Our fourth tip is to communicate with your child and help them decide which path to take. Eventually, it will be important for your child to make a decision about whether their life is better with or without an eating disorder. You can help them do this by encouraging them to map out their life maybe over the next 6 months, one with an eating disorder and one life if they take positive steps to overcome their eating disorder. This is something that's important to do alongside your child and a medical professional or a therapist. Talking to your child about their eating disorder will not always be easy, and there will be times when they don't appear to be logical at all. So it's important to try and read as much as you can to learn about what their experience might be. There's websites and there's books and there's apps that may be useful. Some for you as a parent, some will be suitable for your child or for your teenager, and some will be suitable for you as a parent to read with your child. Eating disorders are particularly stressful for parents because watching your child not eat fundamentally goes against what we expect as parents to be able to keep our children safe and to keep them happy and healthy. And it's associated with such strong feelings of shame and guilt and fear and worry. So it really is important that you look after yourself. As a parent, it's really important that you don't become isolated and you tap into support networks, social support organisations, charities that can offer you support as a parent or carer. And this is really important to look after yourself as well.